Hello, my name is Arnold Castro. This is the journal entry for week 8. This is the final course for the FMP program, and I'm truly excited to be completing this program and preparing for the board examination to get it out there and be helping the community. So, what led me to this path of being a nurse? First of all, when I was younger, I remember this is a very significant story that shifted all my thoughts to be in the medical profession. When I was younger, when I was about 8 years old, I remember that my grandfather went to the doctor because he wasn't feeling very good, and I live in Imperial Valley, which is a to this date an underserved community, but back then it was more severe than it is right now. So I recall that he didn't feel very good, so he used the ER as most people do. But they said that they couldn't do anything for him. They didn't really give him a diagnosis or provide the proper education for him to feel satisfied with with the visit, and he still felt bad. So he set up an appointment with his primary care provider at the time, um, and wait to get an appointment was about a month to 2 weeks to be seen. So he was seen within about a month, I would say. And then I recall when he came back, we were all concerned for him because he's a great pillar to our family. We were afraid to see what the news was, and they diagnosed him with diabetes. We were all very concerned because we didn't know anything about the disease. For all we knew was that people with diabetes die. We just didn't know how soon, how, or anything. Unfortunately, he didn't receive the proper education for him to feel empowered and be able to tackle this chronic disease. Our family was devastated, and back then the internet wasn't readily accessible, so it wasn't like we could Google something as someone would now. So our family was very devastated. We were unsure about the future, and I was just 8 years old, and I was scared to lose him. So I was angry as well outside because they didn't provide us with the proper tools to handle this. He said that he had a follow up within a few months, but he doesn't recall getting any nutrition or how the disease works, what it affects. Well, luckily, I guess eventually everything sorted out. He's still with us, and that's probably one of the main stories that made me shift, made me realize at such a young age how severely underserved we are. Unfortunately, providers here have to see so many people at so little time that they don't have enough time to educate them. They basically provide them a diagnosis such as, "Oh, you have diabetes. All right, we'll see you in 2 weeks." So when you don't have the resources available to be able to cope, not only the patient but the family with the disease, it provides a great stressor. And I recall this. Um, and I recall that my family, we actually thought we were going to lose him, but fortunately he's still here with us, and that's what motivated me to go in the medical field, in particular with nursing, just because of the holistic approach, not just addressing the disease, but also addressing the family, making sure that they have the resources to be able to understand the disease and be able to manage it. And that's what I love about nursing. And as far as a nurse practitioner, just I want to be able to contribute to the lack of primary cares, and I'm really motivated and eager to get out there and be able to serve my community that I see firsthand that they're in dire need of more providers. The ER is booked. It is the waits there are, if you're out within 4 hours, you are lucky, but that rarely happens. Sometimes people stay almost a day waiting to be seen in the ER, and this is because sometimes they don't have same day primary care appointments, or now we do have a little more urgent cares popping up, but they're relatively new, and sometimes they only accept private insurance. So people that are really in need, people that are in the Medicaid program, sometimes don't have access to these urgent cares, so they have to rely solely on the ER. So that's why it's very full. They want to be able to fill in that void, work in a rural health clinic that accepts all insurances or no insurances, and be able to help every single member of my community. One of my great successes thus far is going to be completing this program, because it's going to allow me to be able to serve my community. Besides that is becoming a nurse, because I'm currently a nurse and I'm serving my community. I work at an outpatient, currently working in an outpatient clinic, and we serve all populations. We accept all insurances, no insurances, so I'm able to serve every single member of my community, and I'm truly grateful, and I give it my all, and strive to deliver the best care, the best competent care to the members of my community, and I can see that they're grateful. So what's my greatest success, becoming a nurse, and now it's going to be becoming a nurse practitioner. So I'm really grateful to be able to be in this position to serve. As everybody, we all have challenges to overcome. My greatest current challenge is I have a 3-year-old daughter, and the biggest challenge is to tackle the FNP program and be able to be a good dad, because that's one of my top priorities, if not the top priority, to be a great dad to her. And it's been very hard to be able to give her the attention she needs and be able to focus on the program. But I luckily have the full support of my family. So that's one great challenge that I think it goes very unrecognized. Is the all the time that we're out from our family, and you could see there, especially when you have a 3-year-old, that she really needs you, and she does things to make you know that she wants you there. But unfortunately, we can't at this time. Luckily, I'm almost done, and I'm gonna study hard for my board so I could dedicate more time to her, and be continue to be a great dad, hopefully. Other challenges that remain is we're always going to be faced with a challenge. We don't know everything, but as long as you know your limitations and you know your local resources, you should be okay. My preceptor was good on letting me know that we're not gonna know everything all the time. Don't be afraid to ask. Don't be afraid to refer, and don't be afraid to say, okay, I'll be right back, and go ahead and look at the latest guidelines on how to manage the current situation you're in. So that's going to be a challenge, but I feel prepared to tackle it, and I'm confident that I'll make the proper choices to be able to navigate through any situation. Overall, in this particular course, for the capstone, I've actually learned a lot. For the most part, most of the content was already there throughout throughout this program. We started it during this course. We refined it. We paid particular attention to APA, which had been a long time since I took an APA course. So I've learned a lot about APA and on writing scholarly papers, which I'm truly grateful, and it was actually very challenging as well, as I try to perfect my assignments. It's been truly challenging, but I'm happy with the result. My future goal is to be able to serve the community I live in Imperial Valley at a rural health clinic. And the reason I continue to mention rural health clinic, it's because in a rural health clinic, they accept all populations, all insurances, no insurances. We don't turn anybody away. And that's basically the reason I'm here. It's because I want to be able to serve every single member of my community even if they don't have insurance or not. Unfortunately, some if you work in other offices that only accept X amount of insurance, you're only going to see those type of patients, which is okay. Um, but the purpose that I became a family nurse practitioner is to be able to serve every single member of the community, um, no matter their economical, their background or anything. So that's one of my goals, to be able to serve the rural clinic. Hopefully everything lines up, and I'll be able to work in the current hospital I work with. That's where I did my hours in a rural health clinic. So it's a very challenging place, uh, just because these people are very disadvantaged as far as they lack resources. But here in Upper Valley, it's a strong community, and a lot of things, exciting things, are popping up, and we just have to be in the loop to be able to take advantage and be able to show these resources to other members that will greatly benefit from. So overall, I'm truly excited to finish and to get out there and help out right away as soon as I can. So thank you. I want to thank everybody in USU for guiding me through the program, and I'm really thankful for everything. Thank you.